The whole process probably started around 1999 for me. I started experiencing a lot of shoulder pain doing basic movements. I was really heavy into lifting weights at that point and lifting pretty heavy as far as a percentage of my body weight. But I noticed it was limiting me in the things I was doing day to day. And the trainer told me I had a condition called shoulder impingement, which is something in the rotator cuff. So I kind of knew what to do to take care of it and rehab it. So I started doing that. Well, 10 years later, I'm still doing rehab 2 to 3 months out of the year. That's growing into 3 to 4 months out of the year, or 3 to 4 times a year, about a month each. And I noticed that my strength was decreasing, my mobility was decreasing, and the rehab was taking longer and longer each year. The thing that I really like that goes on here is they show you exactly what it is, put it to you in very plain layman's terms, and then give you an option. And that's the biggest thing that I've liked with this, because it's been a year since I've been diagnosed with this. But Dr. Muha gave me options. We can do this for some immediate relief. We can do option B for maybe some intermediate level relief for maybe 6 to 8 months. But ultimately you are going to want to have option C done, that you're prepared safety-wise to make sure that nothing goes wrong during the procedure, as far as having blood work done, x-rays done, testing for anything that may go wrong or any red flags that may be going on in your body unrelated to your injury. Anything that would hinder your health and what they're trying to get done in the surgery that they're going to perform on you. That's real thorough. And then immediately before and after surgery, when you're talking with the nurses or the anesthesiologist, I never felt as though there was a time period where somebody didn't have an idea of what I was knowing. You can go through certain situations where you may have questions and you kind of don't know if you should ask, or you might be intimidated to kind of ask. They take for granted that you're not going to ask. And they make sure that you know beforehand, so that by the time they're done, I didn't have any questions. They're very, very straightforward with exactly what's going on inside of you, exactly what they can do to fix it, and exactly what your responsibility is going to be coming out of it. You feel as though you develop more of a personal relationship with them when you're here. Like I said, Dr. Neiman and Dr. Muha have completely different personalities when it came to how they relate to me, but I really felt like they were relating to me. Physical therapy is very hard. And the physical therapists and occupational therapists on that side of the building, extremely compassionate, extremely patient, very empathetic in knowing what you're going through. I mean, they see hundreds of it a week. The recovery I've had has gone very, very well, and I believe it's because I've been obedient to doing what they've said to do. Out here, you walk in the front sliding glass door from the first time you come in. If you don't get to exactly where you're supposed to be, you resisted it. You fought it, because it's kind of like you're on a conveyor belt. I mean, the process is so simple, it's so direct. Each person that talks to you is very clear, very concise, very professional. Customer service is great. You don't see that a lot anymore either. If you're experiencing anything in your body that's outside of the scope or the realm of your family doctor's capabilities, please remember to ask for the best. Ask for OIO.